Good morning, everyone. It's still morning, I guess. Thank you for being here for our webinar, HPIO's webinar on the connections between criminal justice and health, impacts on children and families. My name is Haley Aka. I'm the Vice President of Operations and Strategy at the Health Policy Institute of Ohio, and we're so glad to have you with us today. HPIO is an independent and nonpartisan organization. Our mission is to advance evidence-informed policies that improve health and stable and become. I want to take just a minute to thank our funders who advance all of our work, their steadfast investment in our mission, and I'll particularly thank the Ohio State Bar Foundation for their support of our criminal justice and health work. And I also want to thank our 2024 educational event series sponsors for their generous support of these events. We'll have a little bit of time during our short webinar today to answer a few questions. So as our speakers are presenting, please feel free to type any questions that you have into the chat or into our question box, and we'll address those as time permits. We'll also have a few poll questions at the end of our event today, so please stick around for those. Today's presentation slides and other related resources will be available at the HPIO website. And you can find those by going to hpio.net and clicking on the Events tab. We're going to start our presentation today with an overview of HPIO's brief on the impact of justice involvement on children and families. And then we're going to hear from Kim Kale with the Ohio Department of Children and Youth on some related priorities of the administration. As our presenters share today, please keep in mind the many ways that you, either as a private citizen or as a representative of your organization, have the ability to educate policymakers and influence the policymaking process. We're going to revisit this slide at the end of our session today. So with that, I'm going to ask Jacob Santiago, my colleague at the Health Policy Institute of Ohio, to join us and kick off our presentation today. Jacob is the Policy and Evaluation Specialist at HPIO and the lead author of this brief, who's going to walk us through some of the findings and policy options. Thanks, Jacob.
Thank you, Haley. Good morning, everyone. It's great to be with you all today. Again, my name is Jacob Santiago, Policy and Evaluation Specialist here at HPIO. And as Haley said, I will walk us through an overview of our latest criminal justice and health brief. And I want to start us here with this pie graph that describes the modifiable factors that influence our health. When we think about health, we might think about access to clinical care and the quality of healthcare services, and those two things make up 20% of the influence on our health. We may also think about our health behaviors, how we eat, move, and treat our bodies, which represents 30% of this pie. However, in dark blue, we find that 50% of the influence comes from our social, economic, and physical environments, the conditions of our community, including housing, transportation, economic opportunities, as well as interactions with the criminal justice system. In order to improve health, we need to pay attention to all of these factors, including the communities we live in and the policy systems and structures that give people a fair chance at a healthy life. Today, again, we're going to explore some of these connections between criminal justice and health, which is laid out in this framework on the slide now. Poor health, including mental health challenges, can lead to arrest and incarceration, and involvement in the justice system can lead to poor health outcomes like infectious and chronic disease. And at the foundation, racism and poor community conditions hinder opportunities for health and well-being across these two systems. We also know that engagement with the criminal justice system impacts health, safety, and well-being at all levels of society. While incarcerated individuals are certainly impacted, so are their families and communities. HPIO has been exploring these connections for a while. Over the past 3 years, we have produced 4 briefs on the connections between criminal justice and health, and they are on the slide now. The first one on the far left is a foundational brief that lays out the many connections that exist between these two systems. The second one explored the barriers to justice for Ohioans of color. The third brief, released in 2022, included research on pretrial incarceration and the money bail system. And then today, of course, we're going to talk about the latest brief, which focused on the impact of parental justice involvement on children and families. We selected this topic because of the broad interest and support child-focused initiatives have received from policymakers at the state level and from healthcare systems which have taken an interest in the justice involvement of the families they serve. For example, Nationwide Children's Hospital here in Columbus has conducted a line of research on parental incarceration and the health of their patients, which has been informative and helpful in moving this work forward. Focusing on children is also necessary in order to end the generational cycle of justice involvement. Parental rest and incarceration negatively impacts their kids, who experience increased risk in many areas, including worse educational outcomes, mental health, and increased risk of substance use. And all of these risk factors increase the chance that that child will themselves become incarcerated in the future, perpetuating a cycle that keeps families and communities from achieving their full health potential. These kids deserve a chance to break that cycle. Here are the 3 key findings from the brief, and we're going to look at each of them in more detail throughout this webinar. But first, I'm going to frame our discussion today with some brief information about child trauma and adverse childhood experiences. Involvement in the criminal justice system is traumatic for individuals and their families. Incarcerated parents experience traumatic events such as negative encounters with law enforcement, lack of needed medical attention, and separation from family and community. The incarceration of that parent then destabilizes families and exposes children to trauma, which, as we mentioned before, increases the likelihood that the next generation will be incarcerated in the future. Many of us, I'm sure, are familiar with the concept of ACEs. These are a set of potentially traumatic events that occurred during childhood, including different forms of abuse, neglect, and household challenges, including the incarceration of a household member. Exposure to ACEs can result in a variety of negative outcomes for kids as they age, such as increased smoking, depression, lower educational attainment, unemployment, and an inability to afford health care. The ACE pyramid on the slide now provides a framework to explain how these risk factors influence poor health and well-being in all stages of life. Additional research that we've conducted on ACEs here at HPIO indicates that the ACEs circled in red on the slide now lead to the most significant health impacts, and incarceration of a household member is one of those ACEs. This challenge is more common than we may realize. In 2021, 13% of adults in Ohio reported having had a parent incarcerated during their lifetime. And due to inequities in the criminal justice system, Ohioans of color are exposed to this ACE at a much higher rate. This bar graph shows that Black, Hispanic, and other Ohioans of color are almost twice as likely as white Ohioans to have had an incarcerated parent. These are challenging circumstances, and stakeholders across Ohio are poised to take action and make a difference for kids and families experiencing these challenges. I'll now walk through the key findings of the brief. Here is the first key finding. And we'll start with the foundational drivers, why parents are involved in the system. The conditions of our community quality of housing, healthcare, food access, economic opportunity, and crime and violence in a community all shape our health and affect criminal justice involvement. For example, people experiencing homelessness are more likely to become involved with the justice system. Additionally, we know that children need to grow up in communities free from crime and violence, meaning that our policy response to crime should also focus on preventing crime before it happens by supporting individuals, families, and communities. Because of historic and modern day policies and practices that have had racial bias baked into them over decades, communities of color are more likely to interact with the criminal justice system and become incarcerated. In 2021, for every one white Ohioan that was incarcerated, 5.6 Black Ohioans were incarcerated. And this mirrors the data we saw that this disparity is not new and is true for adults in our state, that their parents also experienced this incarceration disparity. And if these racial disparities were eliminated, 40% fewer Ohioans would be incarcerated, with a savings of $638 million in corrections spending per year. But families would also not be destabilized by racist criminal justice policies, meaning that kids could avoid many of the negative outcomes of having a parent involved in the system. Now we'll move through the system, starting with interactions with police. Policing and surveillance, such as traffic stops and pedestrian police stops, often extend into and disrupt the lives of families, including referral to children's services. In 2015, 18% of investigated reports to child welfare agencies originated through police surveillance. Policing, specifically the arrest of a parent, can be traumatic for children who witness their parents' arrest, negatively affecting their mental health. Moving on to the impacts of parents being in jail or prison. Parental incarceration can affect several factors upstream, such as poverty, healthcare access, education, and housing and family stability among children. For example, in 2022, over 5,000 children in Ohio were removed from the home for reasons including parental incarceration. Interactions with children's services can increase when parents are involved in the justice system. And when children are removed from their home, they are often also removed from their community and support systems, including schools and other relatives. There are also ways that parental incarceration impacts child health downstream, negatively affecting their mental and physical health, physical and behavioral development, and increasing substance use among kids, particularly tobacco use. Furthermore, there are economic impacts of parental incarceration, including a reduced ability for families to afford health care. The outcomes above, especially poor mental health, drug use, exposure to abuse and neglect, and being placed out of the home, particularly in a group home setting, can all increase the risk of future justice involvement among youth, even when they are still a child, continuing the cycle of incarceration across generations. The next section focuses on collateral sanctions. Collateral sanctions are legal restrictions on the rights and privileges of people who have had contact with the criminal justice system, particularly conviction. Ohio has the third highest number of collateral sanctions in the country, only surpassed by Texas and California. Many of Ohio's sanctions focus on employment and occupational licensing, ways for parents who have been incarcerated to financially support their families. Here is our next key finding, which focuses on what Ohio has done so far to support children and families. There has been a lot of policy change in Ohio related to children and families, even within this last budget cycle and the creation of the new Department of Children and Youth. And really, what we've seen in Ohio is a lot of policy focus on supporting children and families and keeping families together. To better understand those changes, HPIO reviewed the Ohio Revised and Administrative Codes, state agency websites, and the last 3 state budgets. Simultaneously, we reviewed the evidence of what works to support children and families and paired that with what Ohio is including parental incarceration. There's funding available for schools in Ohio through the Student Wellness and Success Fund and Disadvantaged Pupil Impact Aid to implement mental health supports for children who have been exposed to trauma and work towards the school becoming trauma informed. When thinking about strategies for diverting parents away from the justice system, the evidence identifies crisis intervention teams and pre-arrest diversion programs. Not only is implementation of those programs happening at the local level, the Northeast Ohio Medical University, or NEOMed, received a state grant to develop a training program to help local communities implement them. Our last example focuses on supporting parents reentering their communities after incarceration, including reunifying families. Local reentry coalitions provide support services for those reentering their communities, including job training and higher education, which helps parents be better able to support their families. 43 counties in Ohio are being served by a reentry coalition, and the Department of Rehabilitation and Correction has issued guidance on developing these coalitions. There are more policy changes described in the brief, including some major changes, such as those on the slide now. The big takeaway here is that the momentum we're seeing regarding children and families is cutting across both the legislature and state agencies, and we're seeing movement in the right direction for families who are or have been involved with the criminal justice system to have the supports they need to be a family and to thrive. We at HPIO are excited to see how the new department, along with other state agencies, will carry this momentum forward in their work. Moving on to the third key finding, which focuses on ways to build on the momentum of the policy environment. There are actions stakeholders can take across the criminal justice spectrum to continue improving outcomes for children and families. We include several strategies in the brief, but I will pull some examples out here. I want to encourage us that when we are doing this work, we can all keep in mind ways of addressing the foundational drivers that can lead to parents becoming justice involved and supporting communities most at risk of justice involvement. This can include prioritizing strategies that reduce disparities and address the foundational drivers, and also engaging and listening to the communities most at risk of justice involvement. In terms of supporting the health and well-being of families, policymakers can expand and support local implementation of Ohio Handle with Care, which notifies schools when a child has been exposed to trauma. The Department of Public Safety can develop guidance for local law enforcement to protect children present at a parent's arrest from the trauma of witnessing the arrest. In terms of diverting parents away from the system, policymakers, including courts, can implement recommendations from the Supreme Court of Ohio's study report on intervention in lieu of conviction. This strategy offers court-ordered treatment and dismissal of all original charges upon successful completion of treatment, meaning that parents can stay with their children rather than being incarcerated. However, when parents are incarcerated, the Ohio Children of Incarcerated Parents Initiative partnership between the Department of Mental Health and Addiction Services, Ohio University, and local communities can leverage state and philanthropic dollars to evaluate and expand to related skills building programs of the initiative. Part of these programs allow children and family members to virtually join their incarcerated relative for some program sessions. And then we come back to reentry coalitions and how those initiatives can be further fostered by state and local partners. Take a moment to pause for questions before turning it over to Kim.
Thank you, Jacob. We did get one question about strategies to support families while they're incarcerated. And you just referenced one, so I wonder if you could say maybe just a bit more about the Second Chance Initiative and ways to support families while there's an incarcerated parent.
Yeah, so with the Second Chance Initiative, that is a program that's happening at, I believe, 8 institutions of the Department of Rehabilitation and Corrections that really focuses on helping those who are incarcerated, whether they are a parent or not, to build skills. This can be job skills. It also includes parenting skills. And kind of a part of that is allows, again, as I said, children and other family members to join their incarcerated relative for some sessions of the program. So really evaluating, like, kind of the next step would be, evaluating if that program is, really helping families to reconnect and then expanding and altering it as needed. I also know that the Department of Rehabilitation and Correction has some guidance for particularly mothers, for institutions to help mothers reconnect with their children.
Great, thank you, Jacob. And there are a few more strategies in the brief that are specific to families that have an incarcerated parent currently and things that can be done to strengthen bond and connection with those parents. So, all right, well, thank you, Jacob. Oh, another question. Are there initiatives, and we may not know, are there initiatives including people who are awaiting trial? So people who are held on bond. Yeah, great question. I'm not aware of anything for parents who are held pre-trial off the
I'm
top of
not
my head.
either.
So an interesting question to explore.
There is, as a part of this work, when we were going through everything that Ohio has done, we pulled together a very large Excel of all of the policies that have been implemented over the past four or 5 years. And that is available on HPIO's website on the publication page for this brief.
That's great. All right. There's a few more sort of specific questions in the chat. Jacob, it'd be great if you could head there and respond to some folks directly. In the meantime, I'm going to invite our next speaker, Kim Kale, to join us. Kim is currently a project manager at the new Ohio Department of Children and Youth. Oh, we just quickly skipped past, I'm so sorry, we quickly skipped past Jacob's contact info. So if you have additional questions for Jacob, feel free to reach out to him there or continue typing in the chat, and he's going to head over there. So, all right, now I'll introduce Kim. Kim is currently a project manager at the new Ohio Department of Children and Youth in the Bureau of Foster Care Licensing. He provides consultation and technical assistance on trauma-informed approaches and trauma treatment models in that role. This is a post-retirement role for Kim, who has worked in public service for over 32 years with roles in several state agencies, always with an eye towards supporting the implementation of trauma-informed practices. So I'm going to invite Kim to come and give us an update from the new department and some related work that they've got going on. Thanks, Kim.
Yeah, thank you, Haley and Jacob. And it's a pleasure to be here yet this morning. So, Jacob, I think if you could go to where we start with the DCY goals. Since the PowerPoint is going to be shared with all of the participants, much of what you'll see in the PowerPoint in terms of the information that we've been sharing internally within our own department very much mirrors the work of HPIO. So we want to be respectful of not duplicating. Jacob, just a couple more slides to the actual DCY goals. Right there. Yeah. So I'm super excited to be a part of and thankful to be a part of the new Department of Children and Youth. When I think about really this notion of a one system for families and children, really started back in Governor Celeste's office way back in 1986 when he issued an executive order that said, you guys need to come together and collaborate around multi-system youth. So I guess there is some truth in patience is a virtue. So in our new agency, and for those who may not be familiar, this new agency is bits and pieces of many of the state agencies who were involved and have been involved in children and youth, and now coming together under one umbrella to really look at how we can do things better and how families can access services a little bit differently. Our primary goals are to reduce infant mortality, reduce learning gaps, and reduce involvement with child welfare. And within that, there are various parts of many agencies that are going to be addressing each of these goals. All of these goals contribute to how do we begin to start to stem the tide of individuals who wind up involved in the criminal justice and juvenile justice system. The next slide, please. So we have essentially three pillars of our work. One is around continuum of care, which is focusing on providing a level of support that children and youth need, where and how they need it. Looking at our workforce, much like lots of human services systems, the workforces in early childhood and child welfare are really strained. And so trying to figure out what are the ways that we can attract, keep, and maintain folks in the child welfare and early childhood and child serving system. And I think probably the strongest one is around service coordination. And how do we, as parts of our own department and departments that touch children and family, how do we come together and begin to streamline that service and coordinate the services that families need? Next slide. So very specifically, here are the services that have been brought into the new department, focusing on prevention and early intervention, specifically early intervention, home visiting, the Children's Trust Fund, and infant vitality. Under early education, publicly funded childcare, early childhood education, preschool education, licensing, and Dolly Parton's Imagination Library, and under support, specifically children's services. So that meaning foster, adoptive, and kinship, the Ohio Fatherhood Commission, Family and Children First Councils, Healthy Beginnings at Home, Early Childhood Mental Health Consultation, and Strong Families and Safe Communities. So I want to speak very specifically around the role that I have taken on, and that is working with our qualified residential treatment programs. About 4 years ago, the federal government said it's time that children in out-of-home care, particularly in congregate care and residential facilities, it's time to start looking at the impact that trauma has had on youth who come into residential care. So our kid residential programs have moved to what are called qualified residential treatment programs. And within that new move, there are two primary focuses around responding to the trauma that children have experienced and their families. In particular, every child residential program now must implement an evidence-based trauma treatment model. Ohio has endorsed a list of about 32 of those evidence-based programs. And so kid residential programs must select and have staff trained appropriately to implement that trauma treatment model. In addition, and here's probably the biggest change, all of our kid residential programs must move now to become trauma-informed agencies. So that means frontline staff, that means interns, volunteers, contract staff, anybody who touches the life of a kid in that residential program needs to be trained in a trauma-informed approach. Right now we have roughly 133 kid residential programs licensed through Job and Family Services, now the Department of Children and Youth, and 32 agencies through the Ohio Department of Mental Health and Addiction Services that are moving to this new approach. So that means that kids who are coming in to children residential programs now are going to get the level of treatment that they need, particularly if they've been identified, they've been screened, assessed, and identified as needing treatment for the trauma that they've experienced. And so our job is to focus on how can we help our residential programs. Well, many have done this work for a very, very long time. It's a new way. It's really a new way of doing business in how we respond to kids who wound up in kid residential programs. So while a lot of our focus in this initial phase of the new Department of Children and Youth is on the earlier side, we got to start somewhere, right? And so as we start to look at how can we infuse trauma-informed care within all of the various offices and bureaus within our system, I think we have a great opportunity here to really influence and change the way that we interact and be responsive to. We have a series of trauma-informed care information sheets that we've started to distribute. And the very first one that we issued just last week through a new external document called Our Tuesday Times is focusing on parenting past trauma. And so we've started to lay the foundation for if you are a parent who has experienced things like incarceration, like being involved maybe as your own experience in the child welfare system, sometimes that brings challenges to effective parenting. And so how do we pay attention to that? How do we support families and parents whose experiences may have been such that it's a challenge. It's a challenge for them to be a parent. And so through this series, we're starting internally to work within our own agency in supporting the impact of trauma and what that trauma looks like. Not just incarceration, but abuse and neglect, community violence, community bullying, those kinds of things that impact families and kids. So we provided a set of resources on the next slide that will be included in this PowerPoint that direct you to the work that the Health Policy Institute has done and some of the other national venues for looking at this issue. So it's new. We're learning a lot. We're learning from each other. It gives us a great opportunity to now come really cohesively and begin to look at the family and however that family presents itself and whatever the journey that that family has been through, and how can we more effectively begin to coordinate services and supports that families need. Sometimes they don't often know what they need. And so it gives us an opportunity to collaborate with each other internally differently than we've done in the past. So super excited about the prospect of what this new agency is going to be able to do. And I think really being very responsive too, because a lot of thought was given into how the organizational structure. There were a lot of community meetings, a lot of focus meetings with families and agencies and communities, and we took that information and we brought it together to say, you know what, this is how we have to start doing business. And so we're learning a lot. Every day is presenting itself with new opportunities for us to grow as professionals, for us to grow as policy determiners and shapers, and how we can more effectively do the kinds of stuff that families need us to do, and how children can become more resilient and become contributors to their own ability to parent later on in their lives, and become participating and good members. So that's a quick snippet of the new department. If you go to ohio.gov, you can see our website, the Department of Children and Youth. So I don't know if there's any questions. There's
Thank
my
you, Kim.
contact information.
Wonderful. Wonderful. Thanks for being with us, and we're so looking forward to seeing how the work of the department's going to unfold. Checking in to see about questions. And maybe you can look in the chat as well, Kim.
Right now, yeah.
Training grassroots local organization members working with children and parents.
Specifically, today we don't, but if you reach out to me in my history and my relationships with other departments, we certainly can reach out to that and hook you up with grassroots training. Yes, absolutely. I can tell you one other real quick resource that is available through the Ohio Child Care Resource and Referral Association is a trauma-informed care certificate. And maybe there's a way I can get that information out. It is a professional development tool that has access to a little over 80 online trainings around trauma and a number of topics related to trauma and trauma-informed care. It's a very, very, again, it's a professional development tool. It doesn't certify you to do anything. It simply says, here is a structured way that people can learn to move from trauma aware to trauma informed to trauma competent. It doesn't cost anything. Most of the trainings are free, and most of the trainings are hooked to continuing education units. So I think that's probably a really, really good resource for folks.
Thank you. That's wonderful. We had a question about how the new Department of Children and Youth relates to other departments like the Department of Job and Family Services. Can you describe that a bit?
Yeah, so most of us came from what are called legacy agencies. So my legacy agency was the Department of Job and Family Services. So we have a connection. While there are still parts and pieces of folks who do children's work remaining with some of the various agencies, we still go back and we work closely with our legacy agencies. So it's not just we're gone from Job and Family Service. So like Adult Protective Services still remains with Job and Family Services, but there's a connection, right? We work with families, we work with older adults, and with that older adult, there's a family associated with it. So those relationships continue with what's called our legacy agencies. So folks from the Department of Developmental Disabilities, while the children piece of it has come over to the new department, there's still families and there are still neighbors and there are still communities involved where those connections continue.
Absolutely. And thank you all for sharing in the chat. I'm seeing not only some questions that maybe we can pop into the chat and answer a few more, but I'm also seeing you all share resources with each other. So that's wonderful. Thank you for doing that. Okay. Well, with our last couple of minutes, I'm going to take us through our last couple of slides. Thank you again so much, Kim, for being with us and sharing that update. Really appreciate it. Okay, so a reminder that you can find the slides from today's event, as well as a recording of the webinar from today. You can find all of that at hpio.net, and you can click on the Events tab. On the next slide, you'll see our slide for the beginning of the webinar again, the ways to influence policy. Our hope is that this work is helpful for you in your effort to influence policy and to improve health and well-being in our state. There are many ways that people as private citizens or as representatives of their organizations can influence policy, educate policymakers, and move these evidence-based strategies forward. Those could be things like providing data or analysis to a policymaker, giving legislative testimony, inviting a policymaker to visit your organization or meet with you in your community or at your site. There are lots of ways, and policymakers are not only our legislators, but also our executive branch agency folks, and there are policymakers at the local level as well. So with all of that in mind, we are going to throw up some poll questions for you to answer. Some of these have to do with quality of the information that you received today, but also about the information you're taking away and what you hope to do with that information. So see those questions here, and you can scroll down. There are a few. As the poll is thrown, I wonder if there's anything of interest in the chat that any of my colleagues, Jacob or Amy, would like to share. You don't have to. We just have a bit of time while people are answering the poll.
There was a question from Arlene, and I did answer it in the chat, but I thought I'd call it out here as well, about disseminating the brief, in particular to various entities helping communities. As I said in the chat, we're still in the process of disseminating this brief to those who would find it helpful, including local communities, local community-based organizations. And we could all use your help in getting this information out. Yeah.
Absolutely. Absolutely. The link is at the top of the chat. Maybe somebody can post the link to the brief again in the chat. That would be great. And we'd love to connect with you too if you think there are additional ways that we could get the information out, places we could present, meetings we could have. We would welcome your feedback and connection and partnership in that way. All right. Jasmine, you let me know when it's time for the poll to come down. We don't need to share these results. You can just pull that poll down and move to our next slide. Thank you so much for being here today and for engaging in our work. On the next slide, you can see some ways to connect with us. And you also received Jacob's contact information in the slide deck. So please reach out. We would love to connect. Thank you again for being with us, and enjoy the rest of your week. Happy Monday. Thanks, everyone.